opportunities that exist in that space for the budding entrepreneur. And I really believe that, I think what we're seeing in the region and what we're showing, what Karen's shown, is that you don't need to move to Brisbane, Sydney or Silicon Valley necessarily to have a really successful global business with brilliant broadband and the sort of collective that we're getting going here on the Sunshine Coast. You really can live here and gear your business up so that you don't need to leave this beautiful part of the world. It's just not necessarily a requirement anymore. And I really believe that we're getting some real momentum here with our Silicon Beach concept, and that there really is a chance for young budding entrepreneurs to take some serious action and really realise their dreams and combine their ambition with having a fabulous lifestyle and being able to go surfing and raise their children here in this sort of environment. So when looking at all the definitions of e-health, there's so many definitions and complex ones around health IT, health informatics, e-health. And the more that I looked at the definitions, the more I learned that it's an evolving thing, but really those terms can be used interchangeably. So I will refer to e-health or health IT throughout the presentation, but really it's the same thing. And the government, in all of their investment in this space, they seem to be preferring to use the term e-health, so that's what I'm preferring at the moment. But it's really referring to electronic or digital processes in health. Or in other words, it's that intersection of computer science, information science and health. And they meet in many ways, and there's various different forms. The electronic health records, which are evolving rapidly and at lightning speed here in Australia, is really exciting. There's the pharmacies and the pharmacy guild are working so heavily on electronic prescribing, and no longer do you, of course, doctors don't write out scripts anymore, they print them, but they're just now starting to just transmit them straight to the pharmacy. So it's really changing the way things are working in many parts of the space, and a huge one in Australia on a governmental perspective, but there's opportunities for all of us involved at the fringes, is telehealth and telemonitoring. So it's allowing, you can see it in the photo there, nurses to communicate with patients with or without other nurses, doctors to communicate with patients over a geographic distance, and allowing people wherever they're living to access the best of care at a fraction of the cost of travelling, for example. Also, health knowledge management, which is the way that medical professionals learn and retrieve knowledge on mobile devices. So doctors walk around hospitals now with their handheld, and they've got all their apps on there, and they're checking medicines, medicines interactions, and things that just as young as I am just weren't there. I mean, it's just evolved so quickly. It's incredible. The one that I'm particularly interested in is the so-called M-Health, which is the mobile apps in the health space. And apps are exploding, as you probably know, and there's a huge opportunity in this space. There'll probably be some damage done along the way because if people aren't really aware of some of the limitations, privacy issues, I think there'll be casualties along the way of a sort, but that space is a really interesting one to watch. Practice management software, which is quite well established here, but is becoming the norm, electronic payment system, and a way in which health professionals receive their education and training. So Australia's really leading the world, and it's because of our geographic size and our diversity, and also being a wealthy country with those natural restrictions. We've been able to put a lot of money into this and really leading in terms of the way that we communicate with patients at a distance, and that's a really exciting evolving space. And of course the government's recently released personalised, person-controlled electronic health record, which I've signed up to and signed my son up to, and it's more to explore what it is from the patient perspective around how much information's up there that other doctors can see, and how much control do I actually have over what's up there. So we're one of the few countries in the world that has anything like this for its citizens. So health IT is growing rapidly, and the health sector is growing rapidly, and it's because health is an essential service, and governments have recognised and proven that investing in the electronic side of health IT really saves a lot of money. So it's something we're going to continue to see stimulated and invested in. And of course, patients, rightly so, they want empowerment over their information. They want control over their bodies, and it really is the health sector and patients really working out how to meet in the middle so that everything's done in a safe way, but in a way that the patient's happy with. So this is more aimed at the person with that entrepreneurial spark or entrepreneurial seizure beginning to happen, but I think it's really important when you're starting out with a startup and a venture is to be very clear about why you're doing it, because it's going to be rough and it's going to be tough and it's going to cost a lot of money, it's going to be exhausting. But if you really know why I'm doing it, I find that helps you figure out how, and it keeps you going when it's difficult, and it keeps the faith and makes you more likely to succeed. About a week after I decided to do my startup, the fears started to creep in, and my confidence started to waver. I thought I was a pretty confident young person, but I'd never come across anything that had made my confidence waver the way this did. And I think it's because I felt I was taking a risk. I wasn't sure about what I was doing. I wrote a business plan and then overanalyzed it and got into what I call analysis paralysis, where I was so afraid of taking that step that I actually did nothing for quite a long time. I worried about how to fund it. I didn't have a lot of entrepreneurs around me. I'm an introvert, so I wondered if I'd be able to promote and sell the service in a way that was necessary. And, wondering about to take on a partner for that bit of security, someone in the industry who could help me along or whether not to. So my brain was full of ideas, half of it, and the other half was absolutely freaking out. And so I went to friends and family and I told them about my great idea, and naturally I got a whole heap of responses, some of which surprised me. Some of these I heard and some of them I continue to hear. And so the lesson is choosing advisors well, and if I wish I knew what I knew now if I was starting over again. But it's finding people to talk to who've done it, who've failed and succeeded and done it, or people who support and work in centres like this who their heart really is in seeing you succeed. Because a lot of people might be challenged by your risk-taking, by your pursuing of your dreams, by all of that, and sometimes people subtly want to bring you down a little bit, or they want to point out all the reasons why you might fail, and it may be because they care about you, but also it might be that they're envious of the choices that you're making. And I don't say it to big note, but just to highlight how it continues to this day, that even when we got to the point where in an 11-week space we were taking home for ourselves well over $1 million to do whatever we pleased with. It's more money than I ever planned to have, and this wasn't really a money-making journey, it was a creative journey. And perhaps when the passion's there, eventually the success follows and money follows. And we're donating hundreds of thousands of dollars a year to brilliant charities in Australia and around the globe, and just really feeling like this had just worked out so much better. And still people would say to me, "Oh, that's great that you did that. Are you going to go back to general practice?" And at this point I think I was working maybe 1 hour a day from my apartment at Noosa, from hotels around the world. We've worked from boats, we've worked from cruise ships. And I think it just shows that you just need to be careful who you talk to when your idea's in its infancy. I think a lot of ideas get shut down through the fear and through the negativity. So Medimobile, I passed it through these 10 qualities of adventure when I started, and it met most of them and gave me real confidence that I put it through a filter and a test, and yes, it was likely to succeed. And I actually added to the authors, I added my number 10 here, because I think being in a growth industry makes you more likely to succeed. So if you're in healthcare or at the moment confection or pet care or something like that. These are very strongly growing industries, and while it's great to have a brilliant new idea that the world's never seen, there's also recognised advantages in this, the second mover advantage, where you can see that someone's paying for a service or a product or something out there, and you can come along and do it better, faster, quicker, more efficient. And that's the advantage of the second mover, that the market's already tested because someone's got a semi-successful business in that space. And then once you decide what you're going to do, it's just focus, focus, focus. So it's find a niche, especially in healthcare, because it's so vast and it's so complex that if you can just specialise in one thing and do it really, really well, I think you're more likely to succeed, and just concentrate your power on what your goal is. Some of the critical factors for success, I think with the right idea, if you can find something that's scalable and it's really pertinent to a centre and a place like this, that it's an idea that you can scale up, so it can be global, it can be national, but it's not something that's going to be too dependent on you, and hopefully eventually saleable. It's something that someone's going to buy. Tight financial control, of course, and I'm a big believer in systems and organisation, and if you can create a really great system, eventually you can backtrack your way out of the business, employ people to do the jobs you used to do, and empower them to do them. And it allows a very reproducible, reliable experience for the customer and for your staff that helps them know that they can rely and trust on you, and it keeps them coming back for more. Some potential pitfalls, there's so many, but I think, and some of these relate to startups in generally and some to health IT. I think that the health industry is somewhat resistant and somewhat suspicious of entrepreneurship and new things, so you really need to, I think, be in the industry to understand that mindset, and everything you do needs to be catered towards quality and privacy and protecting patient information and making sure you convey that sense, but also that you back it up. So failed security against cyber threats is already bringing some health tech companies down, and poorly executing and actually causing patient harm. So there's a strong element of responsibility when you're working in the sector. And also number 12, which is not launching too early. For example, if you were to build a health app or a piece of health software, you have this grand vision for all the things it will be able to do, and a certain amount of funding, be it your own or from an investor. If you can build a minimum viable product, so build one part of your app or your website that can be launched and give your early adopters a great experience that's properly done, then you can use feedback from them for the next module or the next part of what you're doing and the next round of funding, so you're earning money as you go rather than getting $200,000 from some funding source and sinking it all into making your entire vision and launching it, and there's bumps in it and all kinds of problems. So, and final tips. I think a concise business plan and a concise pitch and a very evolving business plan. You don't write a 30-page document unless you have to, unless you're going for funding, but if you're self-funding, it can actually be something quite simple. I think number 4, choosing something you already know. So a lot of entrepreneurs go into startups because they're actually sick of their day job and they want a complete change. So imagine coming out of the health sector and starting in it and not really understanding the nuances, whereas if they start in an industry they've been in and find a niche, their understanding is just so much more, got so much more richness and depth. So if you do something you already know, you're much, much more likely to succeed. I think develop systems from the beginning and tight financial control, whether you've got, I've got a CEO in there now, but I read it early in my business journey that you never ever let go of financial control. And no matter how big you get, and I think even Lindsay Fox might have said it, with a multi-million dollar, hundreds of $1 million company, still at the end of the day has control of the finances. And I think an exit strategy, even if you never use it. And then enjoy it, because you worked really, really hard for it, and then share it. And I think entrepreneurs to mentor other entrepreneurs, to speak to other entrepreneurs, to give money to charities that they feel passionate about, whatever it may be. It's good to pay it forward, and I think it's the right thing to do, and it also feels really good as well. I've got a few resources in e-health here, and the one that I want to draw your attention to is Pulse magazine, which you can subscribe to on their website, and it's Australia's first and only magazine. It actually exists in physical form, but the online and the email form are brilliant as well. It's very up to date, very on the forefront, and it's solely focused on e-health in Australia and New Zealand, and it's a great source of inspiration. And that's my email address for those who wish to contact me for any reason. Thank you.